patient was driving on the freeway. It's guardrail, and this is how you find it.
Okay, cool. Not cool, but all right. So BSI. Then I'll go through my PIN-MAN. So my personal partner, patient safety. My environment, because you said we're on the freeway, I'm sorry?
Yeah.
We're on the freeway, we could be dealing with, obviously, debris of the motorcycle, debris of any car that you may have come in contact with. Traffic that's coming in, so I'm gonna make sure that Joe, who's driving my ambulance, blocks off the incident. Number of patients, we just have one.
Yeah.
Mechanism of injury, nature of illness, definitely a mechanism of injury, so I'm gonna go with MOI. Additional resources, because this is a traumatic event, we don't know what's going on, we're definitely gonna call ALS, we're gonna call CHP, and that's about it. Need for extrication, definitely. At this point, I'm gonna have my partner, Joe, go ahead and hold C-spine. Before we do that, we're gonna go ahead and make sure that we get the attention of the patient to make sure he is unconscious. Sir. Is he unconscious? Sir.
Unconscious.
Okay, at this point now I'm gonna have my partner go ahead and hold C-spine. Okay, PIN-MAN is now done. My general impression is it looks like we have a 20-year-old male who was involved in a motorcycle accident, seems to be unconscious. As of right now, it definitely looks life-threatening, but no immediate life threats that I need to handle. Airway, I'm gonna go ahead and check the patient's airway. Because of the traumatic event, I'm gonna go ahead and do the jaw thrust. We're gonna open up the patient's jaw. Is the airway pated?
Paid.
Okay, now we're gonna go ahead and assess the breathing. Does my patient have breathing?
You see chest, rise and fall.
Perfect. Now I'm gonna go ahead and check circulation of my patient. Do I have a pulse?
It's fast and regular.
Okay, fast and regular. Okay. I don't know what that means. All right. So now at this point, I'm gonna go ahead and circulation. We can go through COPS. Do I see any obvious signs of bleeding?
No.
No. Okay. We're gonna check cap refill. Do we have cap refill?
Yep.
Okay. Again, my patient does have a pulse. Skin signs. Do anything notice anything about the skin signs?
He's just hot and dry.
Okay.
Above his nipple line and below it's pale, full diaphragm.
Okay, so he is showing, if he's below the nipple line showing pale, cool, and diaphoretic, he is showing signs of shock. As of this point, I'm going to go ahead and treat for shock with power. So position of comfort, he's already supine. What do you call it? Oxygen. We're going to give him oxygen non-rebreather. Via non-rebreather, 15 liters per minute. Why am I going blank? And warmth. Thank you. Warmth, we're going to put a blanket on him and we're going to do rapid transport. COPS is done. Any disabilities or deformities that I could notice? Okay, so we're gonna expose the chief complaint. Because my patient's unconscious, we don't know what the chief complaint is, so we're gonna go ahead and expose his whole body. So we're gonna go ahead and take off. Sorry, sir. You're gonna wake up. You're gonna be naked. Okay. All right. We're gonna expose. My field impression is I have a 20-year-old male who was involved in a car accident, showing signs of shock. We administered O2 via non-rebreather, 15 liters per minute. We're gonna, ALS is on the way. ALS is how far?
5 minutes.
Upon ALS arrival, we're gonna be transferring code 3 to the nearest trauma center. Okay, at this point now, I'm gonna go into my secondary trauma assessment. Okay, so now I'm gonna go ahead and check the head. So I'm gonna check the whole body for DCAP BTLS. That's deformities, contusions, abrasions, punctures, tenderness, lacerations, and swelling. Again, that's deformities, contusions, abrasions, punctures, tenderness, lacerations, and swelling. I'm gonna check that for the whole body, but I'm gonna check the head. Do not let go of C-spine, sir. All right. At this point, I'm gonna check the head to make sure there's no blood. Do I see any blood?
Nope.
Okay. Now I'm gonna check the frontal bone, make sure it's together. The cheekbone. I'm gonna check the eyes, checking for raccoon eyes. Do I see any of that?
No, but you have one blown pupil.
Okay. And at this point, obviously, if I had my pen light, I'd be able to check his pupils. I'm gonna check behind the ear for battle signs. Do I see any battle signs?
No.
Okay, perfect. I'm gonna check behind the neck for any step-offs, any deformities or anything back there.
You feel one step off.
One step off. Jesus, Jake. All right.
You're doing really good.
Okay. So at this point, I'm gonna go ahead and put on the seat collar. Before I put on the seat collar, because of the awkward position of my patient, how weird his neck is, I'm gonna check the clavicle as well. Check for any instabilities. Check for tracheal deviation. Any JVD. Do we see any of that?
No.
Okay. So, just like my partner just stated, which I would have felt if you would have said during the test, I'm gonna do the halo test. Halo test using obviously the 4x4, checking for any CSF. Do I see any?
No.
Okay. Again, I already checked the clavicles. Now I'm gonna go ahead and check the thorax area, so it's chest area. I'm looking for any medical tags, I was checking for stomachs up here. I'm looking for any medical tags, any tracks or tats. I'm also looking for paradoxical movement. Do I notice any paradoxical movement?
Yeah, he has 2 broken ribs.
Yes, 2 broken ribs. Okay, so we might, because he can't, because he has 2 broken ribs, I'm not going to apply too crazy pressure, but I am going to, when he's inhaling and exhaling, I'm going to see where exactly the broken ribs are at. I'm going to do a sternum rock. I'm a disgusting person, so I usually use my whole hand. I'm going to use just my gloved hand to sternum rock back and forth. Do I notice any instabilities?
It's good. Intact.
Good. Okay. Now I'm going to check the abdomen area. I'm looking for, what do you call it? For, thank you, sir. A AAA, abdominal aortic aneurysm. So, or Dr. Gem. So, looking for any distension, rigidity, or guarding. Do I notice any of that? Okay. And I'm going to again palpate the area, all 4 quadrants. Okay. Now I'm going to do the hips. I'm going to go ahead and bring them in and down. Do I notice any instabilities?
No, it's intact.
Okay, I'm checking the pubic area for any priapisms because he is a man, or any bleeding if it was a female. Do I see any of that?
Yeah, you have priapism.
You have a priapism. Okay, spinal injury. Okay, so I'm gonna do some offset pressure. Offset pressure throughout the thing. Because my patient's unconscious, I cannot do CMS, but I can check his cap refill if anything, and check for pedal pulses. Do I have them?
They're there, but they're faint.
Okay, all right. Now we're gonna check the other leg. Offset pressure, offset pressure, offset pressure, checking pulse. Same, both are faint.
That one's done.
This one's done?
Yeah, that
Damn
one's
you,
gone.
Jake. All right, because this one's done, Jake's getting complicated, I could check the popliteal pulse to make sure that there's a pulse in here. Do I have a pulse at the popliteal?
Nope.
Okay, checking the patellas to make sure they're all there. Now I'm gonna go ahead and do offset pressure on his extremities. Offset pressure, offset pressure, offset pressure, offset pressure. I'm gonna check for a pulse. Do I have one in my arm?
Yes.
All right. Offset pressure, offset pressure, offset pressure, offset pressure. Do I have a pulse?
Yes.
Okay, perfect. All right. At this point, we didn't notice any deformities or anything besides. Do we notice any deformities in the leg because he was having a pulse?
No.
No deformities in the leg, so I don't know what's going on here.
His spine. His spine is messed up.
Yeah, we know that. We know that. All right. I'm told that by the priapism. I'd have to do the leg. All right. So now we know we've checked the whole body. Now we did the details. So now we're gonna go ahead and flip the patient to. We can check the back. At this point, can I have Ryan? Can you help me out? Okay. You're gonna get on this side. So we're gonna flip the patient towards us.
Heads count?
At the head's count. So Ryan, you're gonna go ahead and grab his hip, right, and grab his leg. I'm gonna go underneath you, and I'm gonna grab the shoulder area. At the head's count, we're gonna rotate towards us. Ready?
1, 2, 3.
Okay. Again, I'm gonna check the head to make sure I don't have any bleeding. I already checked step offs over here. I'm gonna do some check step offs on the back. Do I have any?
No.
All right. Checking for any gunshot wounds, any exit wounds, any deformities, or any cessping of the blood back here. I'm looking for incontinence. I'm looking for any sacroedema, and that's it right here. I'm also looking at the legs to make sure the legs are all good. Do I see any? Yeah, we also have lung sounds. All right. Also have lung sounds as well. What do you call it? Do I see any of that?
No.
All right. Because I messed up. Thank you, sir. You know what? We're gonna do this right. Bring it back. We're gonna go ahead and bring them down because I forgot my longboard. We're gonna bring them down. Sorry about that, guys. We're gonna do it one more time. Excuse me, man. You're good. Stay right there. I'm gonna get my longboard ready. Make sure that it's clear next to my patient. This is not how you wrap. Okay. I did not notice any deformities or any injuries to my patient, so it does not matter what side I put the board on. Okay, get as close as possible. Okay, all right. Never walk over your patient. do. Alright, one more time. Perfect. At the heads count, we're gonna go ahead and rotate towards us.
1, 2, 3.
Okay, don't need to check it anymore. We're gonna put it at a 45-degree angle. Really put it inside of our patient. Okay, at the heads count, we're gonna put him down.
1, 2, 3.
There we go. Good job, gentlemen. All right. At this point now, we're going to. Do we need to? I do a pretty good job at this. All right. At this point now, we could go ahead and start strapping our patient in. Ryan, you're way too close to me, sir. All right, because our patient's unconscious. All right, because our patient's unconscious, I'm gonna go ahead and strap one arm in and leave another arm out for the medic. But if I wanted to, I could go straight across. Don't pick it up. If my patient were conscious, I would tell him to take a deep breath so we could go ahead and make sure that they're tight enough. But because he's not, I'm gonna wait until the patient takes a breath on his own and squeeze him down. Now we got the cheese blocks. This is why Rolando failed his EMT class the first time. All right, go ahead and put your, do a little butterfly with your hands. There we go. All right, we'll hold on to these guys now. Where's that string coming from? The shorts? And the tape. Tape. Brown, where's the tape at? Attaboy. Attaboy. I know I brought it out. Is that over there? Just give me tape from one of the overhead. This is not the tape you guys will be using during the test. Okay. Just make sure they're secure. We're gonna go one more time. Alright, you can go ahead and take them off now. Again, because my patient was unconscious, there's no reason to be checking CMS, even though he is on a longboard. I could check pulses again. Do I have pulses on the arms?
Yeah, pulse on that.
No pulse on this foot, right?
We'll check the other foot. Yeah, you don't have a pulse either.
Alright. We did something wrong then. But as of right now, we're going to go ahead and load him up and we're going to transfer him to the nearest hospital, code 3. Alright.
Where are you going?
Here's the test.
Where are you going?